Good morning and welcome to the Health Leaders Revenue Cycle Now Online Summit. My name is Eric Wickland and I'm the Senior Editor for Innovation and Technology here at Health Leaders. And I'm going to serve as the moderator for today's session. This is the first two sessions today. This session will be titled How to Improve Patient Engagement in Today's Healthcare Revenue Cycle, and it's sponsored by Waystar. Thank you to our sponsor for making today's program possible and to you in the audience for participating today. Before we get started, I do have a few housekeeping details, and I'm reading off a script here. This program will be 60 minutes in length. Please note that an on-demand version of this program will be available approximately one day after the completion of the event. And it can be accessed using the same login that you use for this live program. To ensure that you can see all the content today, please maximize your event window and be sure to adjust your computer volume settings and or PC speakers for optimal sound quality. Next, you'll find a resources list for today's webinar in the upper right corner of your screen. Here we've listed supplemental resources and the event program guide for you to download that provides topic and panelist information for each session. Now, at the bottom of this console, you're going to see some multiple widgets. One, which is for the Q&A session. We will have a Q&A towards the tail end of this program. To submit a question, click on that Q&A widget. It may be open already and appear on the left side of your screen. Now, you can submit questions at any time during this presentation. However, they might not be answered. They shouldn't be answered until that last, 10 or 15 minutes or so. And finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. Okay, we're done with that. Let's get on to the conversation here. We've got a wonderful panel today and a really good topic. At this time, it's my pleasure to introduce our panelists. We have Shannon Ducat, AVP of Patient Access with ProMedica Health. Seth Katz, VP of Revenuecycle and Health Information Management at University Health Kansas City, and Katie Honorato, Solution Strategist at Waystar. Thanks to all three of you for taking part in this today. And now with that, I'm going to jump right into the conversation here. And our first question gives everybody a chance to understand what we're coming from here. So, and I'll start with Seth on this. Could you please tell us a little bit about yourselves and your organization and how patient engagement fits into your revenue cycle strategy?
Happy to, and thanks for having me. So my name is Seth Katz, and I work for University Health. We are a academic medical center and a safety net based out of the Kansas City area. So as a safety net, that means we have interesting payer mix, a lot of Medicaid, a lot of self-pay. And what that means when it comes to obviously our patient engagement and our digital engagement strategies is that we have to approach things differently, I think, than your average hospital that might be in a suburban area or have a more affluent population. We have patients who might have difficulties accessing technology or all the resources needed to do those things like self-scheduling or mobile check-in and things like that. So coming up with unique ways to reach that population, still keep them engaged, still keep them showing up for their visits, getting them the care and the meds they need. Take some outside the box thinking that I think we'll probably talk some about today. But the key strategy is, if anyone else, for growing your organization and continue to be a community asset.
Okay. Let's go to Shannon. Sorry.
Hi, thanks for having me. I'm Shannon Ducat, so the AVP of Patient Access for ProMedica Health System located in Toledo, Ohio. I oversee the pre-service services for all of our revenue cycle operations, so centralized scheduling, prior authorizations, financial clearance, patient estimates, pre-registration, and then patient registration. And that's for our 11 hospitals and about 500 outpatient sites throughout Northwest Ohio and Southeast Michigan. I started my career in 2002 with ProMedica as a registration specialist, so right there in the front end. And, we've really come a long way since 2002 with all of the processes on the front end. And I think today, patients want their healthcare experience to be as seamless and as convenient as online shopping and online banking. So for our strategic initiatives, we're really focused on expanding those self-service tools and allowing for them to have that convenience with our health system on the front end.
Okay, thank you. And Katie.
Hi, thank you for having me. My name is Katie Honorato. I am a solution strategist at Waystar. While Waystar is an end-to-end RevCycle partner, I primarily support our patient financial care solution suite within that RevCycle umbrella. I've been in the RevCycle IT space for just about 10 years. Definitely looking forward to the conversation and hearing how, a partner like Waystar, getting frontline feedback from people like Shannon and Seth, I think are really helpful to continue to allow people like me to, partner with providers and clients, hospitals and health systems to better the experience across the board for both, I would say, providers, staff, and patients.
Great, thank you. I think it's safe to say that the healthcare ecosystem is evolved and is evolving. It's changing almost daily now. The convergence of new technology and the idea of patient-centered healthcare is changing how health systems address patient care. And certainly part of that process is addressing patient payment, helping patients understand what they owe, and so on and so forth. This first question, I want to talk a little bit about that convergence, and I'm going to start with Shannon on this one. How do you use technology to connect with patients before they actually get to the hospital? Where does the process start?
Yeah, so in early 2024, our centralized scheduling team, we were making all outbound efforts and trying to contact patients to schedule their appointments and kind of chasing them. We're calling them while they're working. So one of the things that we did, using technology is we created an automated workflow. So when providers order a test for a patient, we're now texting them or automatically calling them the next day. And, it's a automatic phone call that states, we received your order, and you can connect by pressing 1 on your phone or, while we're having the conversation with them, so that they can connect with us if it's convenient. If not, they can call us back. So we kind of turned our scheduling center around and went from a completely outbound call center to a completely inbound call center. And we do that. We make 5 attempts over 90 days. So we're constantly reminding them to connect with us, secure their service. In addition to that, we send them a self-registration link, and then we also are sending them their patient estimates through our online portal. So we've done a lot on the front end using technology to connect with these patients before they arrive for their service.
Okay. And Seth, how are things with you on this front? How do you connect with the patients before they even show up at the hospital?
Very similar. You want to make it since you want to make this as seamless as possible. If I can, redo my car tags through text messaging, why can't I make an appointment and fill out all my forms and everything? So that's what we've been investing in as well. We call it our digital front door, making it as wide as possible, as easy as possible for patients who might want to self-schedule, who want to do their mobile check-in online, so they can just come in, go to the kiosk, check in, go see the doctor, and go on their way. You talked about payment forms. We've recently upgraded some of our software, just a newer technology, to make sure we can, again, meet patients where they are by being able to take things like Apple Pay and Google Pay and Zelle, and not just the standard, cash, check, or charge sorts of things. So it's always about constantly updating and make it as easy as possible. To Chan's point, also, right, it's price transparency and the No Surprise Billing Act are a big part of the patient experience now. Having more access to what their potential care is going to cost them is a big deal. And so having the right technology to help generate those estimates quickly, get them out to patients, being able to help answer questions about why a cost is what it is or not, or why they might owe what they do or not, is a big part of the patient experience now. I don't think the days of kind of hiding, waiting to get their EOB and freaking out is kind of behind us. So that's really where our focus has been. And I think you're seeing a lot more cost-conscious patients nowadays. Some of that obviously is tied to the law and the more visibility that's been given to costs and charges, but also with the way the economy is going up and down right now, a lot of people are obviously a little more worried about that. So they're going to be more conscious of what things are going to cost them in their care settings. So yeah, just meeting patients where they are, giving them access to the information in real time, giving them the tools that say, you don't have to get on the phone and go through some, absurdly long phone tree just to leave a voicemail to get a call back. As she said, like in the middle of your work day when you're probably busy and playing phone tag just because you need a med refill or just because you need to get a physical or whatever else is a big deal. That's what patients expect. And I think it's fair to say that hospitals that don't lean into that mode and that idea are going to be left behind, because I don't think the current and the upcoming generation are going to be as loyal, where like my mom, who's had the same PCP basically her entire life, if I can't get in when I need to or when my kids need to, you're going to find that other hospital that is going to make it seamless and easy to get into. So it's also just a key strategy to grow and retain your patients.
Yes, certainly. A lot more competition in the space nowadays, and the ability to jump from one provider to another is so much easier because of the technology. Is this what you're seeing across the industry, Katie?
Yeah, I think that both of Seth and Shannon have kind of nailed that on the head. We hear that, we see that, we're trying to keep up with that. They both alluded to, other areas in consumers' daily life where we're using it, right? I think that holds true. Obviously, things like Amazon are a pioneer in online engagement. But even to add on to some of the examples already used is one big game changer for me was being able to grocery shop through an app and have it delivered right to my front door, right? I mean, so it is across industries where consumers are engaging that way. And so digital communications is going to be the driving channel and is going to be key in healthcare. And Seth alluded to it as well. It's, the next generation that are sort of only engaging through those channels across their entire life, right? And so keeping up with that momentum, I think, is going to be key.
Yeah, certainly. Okay, let's go on to the next question here. And I'll start with Seth on this one. What RCM, revenue cycle management tasks, can be addressed during these connections? What can you do online with a patient prior to the visit? What should you do? And maybe what are certain tasks that maybe you shouldn't be doing at this time? And how does this improve the process?
I mean, I think you can do a lot, right? I mean, you can take their ID and insurance information before the visit, so it's already loaded. You can run eligibility. So all that's, set when they show up. You don't have to scan cards in and slow things down. You can obviously fill in, pre-visit questionnaires and things like that through your phone or through a website, through your portal. So again, you want to make it seamless where they can just come in, get the care they need and go. You can look at financial clearance. You can take get their copays or down payments or whatever the case might be before their visit. Again, I think it's like what we've been saying is we really want to, do those things up front. And what I think is interesting for us, what we found was as we started moving this way, where, we'd had through kiosk check-in either through your phone or when you show up, was we're actually getting a lot better data, meaning when the patient would present to our front desk staff and pick a random clinic in our health system, they'd go through the normal questions. Is this still your address? Is this still your phone number? Is this still your insurance? And of course, the patient said, yep, all the same. And then, of course, we go to bill it or run eligibility to find out, oh, no, something changed. Oh, they moved. Oh, no, now they have a different insurance. And of course, that slows everything down, becomes a problem. But what's interesting is, as we moved more of that up front, we get a lot better feedback. Now, suddenly that they see it, the patient sees it pop up on their phone or in the portal or at a kiosk, they're much more inclined to say, oh, actually, you know what, this did change. Let me go ahead and enter that information. Which is sort of interesting that when we asked, they were just maybe because they're busy and you're standing in line to get checked in, you don't feel good. You're like, just yeah, get me through. I want to see the doctor. But when they're presented with their own information, they want to make sure it's accurate. They want to make those updates, which again just really helps your revenue cycle. Obviously, whatever happens up front flows downhill. So if you get the wrong insurance loaded or anything like that at the beginning, you're gonna have a bad day all the way through until it gets resolved. So just interesting that doing those sorts of tasks, and you probably wouldn't have thought that was anything super crazy just to say, hey, let the patient self-check in the same way they do at labs or the same way they do self-checkout at Walmart or whatever else, would lead to actually a better quality data. But that is something that we have seen.
Yeah, and that certainly that improves the patient visit. It has clinical outcomes as well as financial outcomes down the road. Shannon, same question. It's what can you do before you visit, before the patient visits? What should you do, and are you seeing some unexpected benefits from this?
Yeah, so I would say, the one thing that we've noticed, I mean, technology isn't going to be able to, take over all of the front end processes. I mean, we have a lot of questions, legalities and, requirements, through CMS and the federal government that we still have to kind of connect with those patients. So one of the things that's really worked for us is we've created, instead of waiting for these patients to come on site for their service and having them wait in line and asking all their questions while clinical teams are waiting for them to come back for their procedure, we've created a centralized pre-registration department that is completely remote. And they are just calling patients, 5 to 10 days prior to their service and doing all of that pre-registration, full registration, prior to the patient coming in, which they can also help, with wayfinding, reminding of, times to be there. That's the time we spend with them to go over their financial responsibility. If they have any questions as to why they owe this, we can have, those questions and discussions if they happen to be out of network and they were scheduled. So, although that technology is coming, we still have that pre-registration team who's really kind of going through all those required fields, but getting it done ahead of time, pre-service. And then we also then send them a self-registration link, which they can go in, review everything we've input. So, they're still kind of making sure we didn't misconstrue their address, the phone number didn't change, they still have an eye on it. Review any documents that we sent them, sign their consent form. If they didn't pay during the pre-registration phone call, they can pay during that portal. So, it's kind of, we've integrated the technology still with people to make sure that we are accurate and we're still meeting all of the regulations and guidelines that we need to. But then when they arrive for their service, it's seamless. It's basically, I'm here for my appointment and the only thing they have to worry about is whatever they're there for today. So it's really helped us. We've got a lot of accuracy doing both people and technology. So I think the integration has been a great patient experience that we've implemented at ProMedica.
Yeah. Ideally, you're eliminating the waiting room.
Correct. Yeah.
Yeah.
Virtual waiting room. Mm-hmm.
Yes. Yeah. Yeah. I like your comment too. The idea that people still need to be involved in this. As much as this new generation wants to do everything on the phone or at home, and I've got kids that want to do it that way. You still need to talk to people. You still need to see people, and it's an important part of healthcare. Katie, is this what you're seeing across the industry? Are there any new ideas coming out that improve engagement prior to the visit?
I mean, in terms of the tasks, insurance verification and prior authorizations, right? I think that those are going to be top of mind when we think about, what RCM tasks can be done to address these and sort of maybe improve these connections or engagements with patients, being upfront, the transparency. But the first word that came to mind as you asked this question, and I noticed that both Seth and Shannon said it, is accuracy, right? Just increasing and improving accuracy across the board is going to lead to really successful financial counseling conversations and tasks so that can be, accurate from the front to the back, if you will. And so at Waystar, we actually have seen implementing some of these tasks, having these financial counseling conversations, right? The confidence in the accuracy across the board with, the combined or coupled use between technology and staff leads to a 35% increase in patient collections and a similar percentage, I think 30 to 35% reduction in cost to collect. So we're seeing metrics drive in desired directions with, these RCM tasks in advance.
Okay, I'm going to throw this question in. Yes, go ahead, Seth.
Well, I was going to add something to that. Something you said, and then Shannon said too. Eric alluded to about the, shutting down or losing some of that waiting room idea. I think something that really speaks to us a lot too. I mean, I think patient access is a very hard job to fill, right? It's seen as entry level. The pay is largely entry level. A lot of people, at least in our organization, see it as a stepping stone to get in the door. There's a lot of turnover. There's a lot of pressure, right? You have to know all these different insurance plans and all these different rules and regulations. and yet oftentimes you could go to Target, Walmart, and probably make a little more money. So, and not get yelled at it because you didn't remember the difference between a United MA plan and a commercial plan or exchange plan. So, yeah, I think what we look at too is by moving some of the things up front, it actually does help our revenue cycle. And I think it helps our people too, because it frees up their time, allows them to work on more important tasks than what is, you could argue, is largely data entry. Allows you to maybe redeploy some of those, some of those resources to other things instead of, again, I have to staff 2 people at the front desk because they have to, hand out clipboards and type in all this information. So there is also, I think, a good side of this, which is I think it will help your staffing and your patients and your employees, I should say, feel a little more, I don't know, empowered and be able to work on things more than just button mashing and data entry all the time. And again, so I think we also see it as this is a good transition that doesn't just helps your patients and retains them and meets them where they are and helps with collections and all those vitally important things. But I think there are soft benefits that are indirectly impacting your staffing in a positive way.
Yeah, and that in turn affects the environment that you're in. It improves the environment. It improves retention and so on and so forth. Yes, definitely. Okay. Let's talk a little bit about some of the challenges encountered here. And I had there are some we are getting some questions in the Q&A as well that will kind of foster this conversation later on. Right now, Seth, what are the challenges you face in connecting with patients ahead of the visit or procedure? And you talk a little bit, and Shannon's talked a little bit about connecting 4 or 5 times prior to the visit. Is there too much? Can you overdo it in this? How do you balance between getting in touch with them and not bothering them?
Sure. Yeah. I mean, look, I think it's my dentist's office. I feel like they text you like a month before, 3 weeks out, a week out, a day out, an hour out. Like, yeah, at some point you're like, I get it. I have an appointment at 4 o'clock tomorrow. Like you're doing overkill. So sure. And listen, on the text messaging stuff, whether it's reminders or bi-directional texting or links to sign up for things, by law, patients can opt out of those. So yeah, if you overdo it and a patient opts out, you sort of, shot yourself in the foot. I would say I think there's 2 major challenges though, as we see it. One on the hospital side and one on the patient side. On the hospital side is I think the unfortunate aspect is it takes multiple applications a lot of time to make all this work. So for example, for us to do all those things I mentioned, so the self-scheduling and the check-in and the payments and the texting and all that stuff, it takes about 5 different applications that we merge together. Seamless to the patient, right? They're going to one link and it all works perfectly and that's great. But on the hospital side, like we have to use multiple vendors sometimes to solve some of those problems. And so that's different costs, different interfaces. There's obviously pluses and minuses with certain technologies, how they play with your core EMR, how they play with each other. So one, that's sometimes a challenge, is just to make all these tools work. There could be potentially a heavy IT lift sometimes. And so that's just one challenge, is you're just going to have to deal with the fact that, there are some companies like Waystar that do a lot of different things. There's others that are kind of a best breed and like, we only do this one thing, we do it really well. And so as you make those decisions, again, there's just cost and support and maintenance. And then if there's an issue with one, how all that interplays. So that's on the hospital, I think, one of the challenges of some of that. And on the patient side is, one, like you said, not getting overblown with messages and reminders or links or whatever else. And 2 is just, ease of use. When we were designing this and we were talking like our patient portal and all of our tools sort of work off of that, one of our founding principles I tried to push on the team was we had to think like an app, like Facebook or Instagram or Candy Crush, whatever it is, where, right, it's really easy. You hit a button, there's not a lot of training that you need to do on how do I use it, how do I find what I need. These things need to be intuitive, need to be very simple. I can't ask, a doctor would say, I want to have this questionnaire, built to be done before the visit. It's like 20 pages. And like, I'm not building this. They're not going to fill it out. You might get 2 pages and then they're going to be like, I'm done. Like, this is ridiculous. So, I do think it's designing the system right in a way that's usable, that's easy, that's simple, that is as largely foolproof as you can kind of make it. Though to Shannon's point, obviously you still need people checking that. You still have people reviewing that information. So it is a balancing act. But yeah, I think those are the 2 biggest ones for me, just the technology implications on the hospital side, and then ease of use and intuitiveness on the the patient end.
Yeah, certainly, that's why they call it engagement. You got to get them interested in it to use it. Same question, Shannon. What's the balance there? How do you balance between making sure that patients get the information they need?
Mm-hmm. Yeah, so I would say I would agree with Seth. It's a fine line. Again, we don't want to overdo it. I think with our messaging, when we have an order for a patient, those 5 attempts are spread out for 90 days. So we're doing it day 1 and then not again until day 14 and then not again until day 30. So we're giving some time, but we want to remind them and try to secure that service with us and make sure that they're getting their testing scheduled. When it comes to our pre-registration team, they're making those outbound efforts to try to connect with the patient 5 to 7 days prior to their service. And I think that can get a little tricky. It's something new. So I think, some patients still have a little bit of a trust issue just with the legitimacy of the phone call, making sure that we're really who we say we are. We're talking about collecting money over the phone. We're talking about their financial responsibilities. So there's still a little bit of a trust barrier there, but definitely getting better as we go. And we try to, get the communication out to the patients that these phone calls will be coming so that they're aware. And then I think too, just communication preferences. I mean, we may be trying to call somebody and, they screen their calls because all they want to do is, talk through text. So, I think some of those are the barriers that we find, trying to connect with the patients on the front end.
Yeah, those certainly are challenges. Yes. Katie, how's the industry moving in this direction now? How do you make sure that these messages are going to be received? And is this what you're seeing from the providers in general?
Yeah, I think that these are things that we hear, right? Both Seth and Shannon kind of said it, but first and foremost, internally on the providers, like things like data silos, different solutions or vendors that are sort of owning some portion of data can create challenges. I think manual processes can tend to slow things down. So being able to use tools and technology when and where appropriate and fits, I think is definitely going to provide a shift in staff experience and workflows. Obviously, the topic of today's conversation is all around patient engagement, so that alone is a hurdle out there. And so being able to lean on intelligent automation when and where you can to streamline some of those tasks, and then offering an omni-channel approach to patients, right? So I think, Shannon, you said you've got a cadence that's built in. At Waystar, we definitely align with that idea to use a cadence. We've got reports and data that that we're tracking and trending that so that we can continue to shift the cadence of those communications, because it is a sensitive balance. You don't want to overdo it, but you want to keep patients engaged. You want to continue meeting them where they want to be met. So being able to sort of track and trend that activity and behavior allows the tools and technology to kind of flex when it is appropriate to maybe make changes. Like, what is the effectiveness of the current cadence today? How can we flex and sort of change or update that so that we continue to meet patients where they want to be met, even as that changes?
Yeah, Shannon brought up a good point. Certainly, go ahead.
No, go ahead, Eric.
Oh, well, I was going to say, Shannon brought up a good point, too. The prevalence of scams and spam today means you got a lot of people out there just, as you say, they're ignoring their phone.
Right.
Well, at least messages coming in. Are there best practices, or, how do you make sure that the messages are getting through that all that stuff about paying tolls in states you've never been to and Nigerian money in the bank for you and stuff like that? How do you make sure that your messages are being seen?
Yeah, I think for us, we really try to make sure that our patients are aware, that those messages are coming. But to your point too, I mean, they may get one message and decide I'm going to opt out because, this is a scam. So it's very hard. I mean, we do a lot of internal reporting and monitoring making sure that if patients do opt out, they'll kind of go back in the queue and we can re-ask them and have that conversation with them. But, it's all about kind of letting them know ahead of time, we're not scamming, we're trying to make things easier on you. But yeah, I mean, it's really hard to gain their trust when there's just so much going on around them with all of these different things that you see every day. I just got one of the Turnpike text messages the other day, and my mom got one, and she was like, "Is this a scam?" And I said, "Well, have you been on the Turnpike? It's probably a scam, So yeah, it's hard with those types of situations. So
yeah. I would add one thing we found with that, because we had the same issue, is working with our carriers and our vendors to say that when the text message comes, it comes from it looks like one of our, instead of coming from a 6-digit code, which people are like, what is this? It comes from a number that starts with the same, starts ours, we're area code 816 and then 404. They all start with that 404. So at least they're used to getting the phone number and saying, oh, well, a lot of our patients are repeat. So they know if they're getting a phone call, 816-404 is going to be our hospital system. So it's a small thing, but it does help better than, if you just get some 96388 text message, and you're like, what is this? That you can try to do to at least help a little bit.
Mm-hmm.
Yeah, I think that brand recognition and awareness is a big piece, right? Keeping that consistent across all communication channels is going to be one that helps. And then setting those expectations, like Shannon said, right? If they're expecting communications to come through different channels, and as a provider, as a healthcare organization, you're sort of ebbing and flowing in between, right? Putting them back in the queue. I think that's such a good practice to do that, because we are, as consumers, always kind of changing our methods of how we approach communications.
Yes.
And I was going to add one thing to this about challenges, but unrelatedly, that the other thing I think we don't talk about a lot, though, is has to be a top-down initiative, kind of thing that everyone has to buy into. I mean, you can buy all the best technology in the world and all these things, but if your leadership hasn't bought into it, if the physicians haven't bought into it, it just kind of gets sit there and it'll just waste away. And I do think there's some challenges there sometimes as we go. There's some clinics who are like gung-ho about it. Some physicians like, yes, I want to text and I want them to self-schedule and I want to, do all these cool things. And then there's, of course, the curmudgeons who are like, no, I want to have complete control over my schedule. And I only see new people on Tuesdays at 2:48, or whatever. And, you kind of have to work them along, but say this is just the world we are in. You have to buy into this. You have to sometimes, do a little strong arming. But I will just say that I think is another challenge we don't always talk about, which is it's not just how do I roll it out or what do I purchase, but it is a culture shift to move away from, nope, that telephone is the king of the universe and you have to call us at that number Monday through Friday, 8 to 4:30, and we're going to control how we get you in and when we respond, to saying, no, this is the patient, they're in charge of their healthcare, they're going to be the one to call and schedule those appointments, or they're going to be the ones to go online and schedule them. It is a culture shift, and I do know that obviously that can be a challenge for some organizations or just some people within those organizations.
Oh, certainly. Yeah. And there's certainly some people, there are still some people out there who just want to talk to a real person.
Yeah.
They don't want to hear a computerized voice or anything like that. They still want to talk to people. It's a generational thing, really.
And that's a good point, Eric, because I think that's why you have to still maintain both. As much as we want to convert, everything to technology and utilize that technology, we still have to be there, to provide to those patients who, don't have access to the technology or, can't utilize it, or still want to have that conversation. So it's really trying to meet in the middle and be available both ways.
Yeah, certainly. Yeah. Okay, let's move on a little bit here. Good question here that kind of lays the groundwork for what I want to talk about. You mentioned, Seth, the idea of getting buy-in, and part of that is proving the ROI of these and defining the ROI of these technologies so that your C-suite knows the value of these types of services. Prior to that, how do you lay the groundwork for these conversations with patients? And it's something we talked a little bit about. What happens when a patient declines to participate? How do you make sure that the information still gets to them? Shannon, why don't we start with you on this one?
Yeah, so like I said, I think I go out to all the different hospitals. I'm making sure that I'm providing all of the information internally to Seth's point, from the top down, to make sure that, they can have those conversations with their patients, in the offices and in their facilities, because patients trust their doctors. They see their doctors all the time. They get familiar with the office staff, the nurse. So ensuring that they're educated on what we're doing from a patient access, because we're corporate, and front end revenue cycle is kind of a separate department. So just ensuring that education and everybody is aligned across the system. And then I think too, just trying to, when patients do decline, I think we try to kind of tell them, if you do this, it can really expedite, your arrival process. We can take care of all of this now, just make things easier for you. But again, some patients, they don't want to. They're used to doing it when they get there, or they're nothing's changed, everything's the same, kind of just leave me alone, let me see my doctor. And again, we make sure that we kind of, meet those patients just the same as we're trying to meet the ones that do want to involve themselves in the technology. So we can't force everybody to do it. We do try to encourage it. We try to, provide the positive of making sure, it's done pre-service, but, we still have registrars on the front line day of service that can take care of these patients if they wish to not participate. So again, it's meeting that middle ground for both of the patients.
Okay, Seth, same question. How do you prepare patient? Well, and Shane, you kind of got into that too. Not only patients, but how do you prepare your providers for something like this?
Yeah, it's tricky. I know before we really invest in the technology, our CEO called a leader, a meeting of kind of our senior leadership and our physician chairs, was like, look, if we're going to invest in this technology and this culture change, like everyone at the table has to buy in, or this is just gonna be a waste of money. So it can be tricky. And look, there's some groups that still struggle with it. Some individual physicians that still struggle with it. Some individual clinics that don't like it as much. And we try to listen to them and see if we can't come up with best practices and ways to resolve some of their concerns about some of these challenges. But I will say, I think after a while, people find the technology works very well, and they find a lot of wins. For example, at first saying, well, we're going to do some texting back and forth, some secure bi-directional texting with patients. I get the pushback, some of the fears. Oh my God, it's another thing I have to look at, another thing I have to do. But then when you're like, yeah, but you can do it easily from your computer, and the phone's not going to ring while you have 18 people waiting to check in, like suddenly you're like, oh, well, that actually isn't so bad then. Or, hey, because we push results, this is a couple years ago now, but to our patient portal in real time, you don't have to print out all these letters and mail them to people saying your labs are fine. Like, I think there's some of those, like you said, the ROI, some of those are soft benefits, right? We didn't save money because of it per se, but you save time, and people's jobs don't become necessarily as stressful. People generally don't have, super long test message, conversations back and forth. So they're usually one or two texts back and forth, and then you're done. Whereas on the phone, people start to talk. My mom, she's older. She's going to draw on and on about nonsense with the person probably for 10 minutes. So you do help cut down on some of that. But I will say this to your second question. And I say this coming from our angle of, again, we're a safety net. We're about 50% Medicaid. We have a lot of uninsured patients we see. We found very few people decline. I think when we started this, whether it was our patient portal, whether it was at health information exchanges, whether it's all these ways we want to go to your phone for mobile check-in and payments and whatever else, that surprisingly there just weren't that many. We thought it'd be a higher number, but it just wasn't. It was a very, very, very small number of people who proactively chose to opt out or anything like that. Like, most people, I think, get the value of it, or if they're like, well, I don't know if I want to do that, we can help explain why it's important or why it's a good idea for them. And so the number ends up being very small year over year. And to Shannon's point, we do the same thing. We try to follow up every so often and be like, you sure you still don't want to do this? But it's just such a small number. And I think it almost harkens back to the fear I know a lot of people have when you first started getting self-scheduling in the market, and patients and healthcare workers would say, oh my God, what if people schedule like 20 visits and all this crazy stuff? And you're like, It's just not what human beings do. You don't make 20 haircut appointments, with your stylist or something. You don't order 20 pizzas, with your local pizza place. So, I think maybe there's this fear that people won't like it, they're not going to use it, they're not going to understand it, regardless of their socioeconomic background. And the truth is, that's just not what we've seen. And so it hasn't been as much. I'd say we probably spent more time educating and working on our internal staff than we did on our patients.
Very good point to make. Yeah, the fear of the unknown certainly has an impact. But Katie, the same question is how do you get a health system to understand the value of this type of technology?
Yeah, I think it's, the trust and the confidence that can come from, a healthcare IT partnership. Obviously, there's change management, both, across the board, internally with a provider, externally with patients. There's some change management that takes place there. Some folks are just, kind of stuck in their ways. And so I think that, being able to provide the confidence and really the data, right, that proves, and the value that sort of proves the outcome, the desired outcomes that we're searching for both patients and staff, I think is going to improve some of that groundwork. I think, for patients, education, transparency, and flexibility, those are huge. Empowerment, I think, Seth, that was you that sort of made a comment to empower staff. I think that's true for patients as well, right? If we're empowering patients with the accurate and transparent information, yes, maybe there is some hurdles, some change management that needs to take place depending on patient population, demographics, types, but once there, then I think that it, leads to an increase of action, really, right? Because they're empowered, they have the information, they can self-serve. I think being able to self-serve is, such a big shift that we're seeing now. And even patients that I know that, we might think like, there's an older generation of patients maybe, right, that are a little bit more resistant to some of the tools and technology. But the data shows, like Seth, you just alluded to, is that that's not true, right? All of my grandparents now have smart devices. They text and send photos, and they are engaging, through other areas of their lives directly through their smartphones today. They're really taking onto it. And our data shows that at Waystar as well, that, we're seeing a big increase that, maybe there is some initial hurdles there, but, once you get the buy-in, you kind of see that spike in activity. Yes. And then I would say, for on the second part of that question, there are going to be inevitably patients that decline or patients that ignore or refuse, that's going to come. So I think that internally, right, topics that we talk about with our clients is just making sure that there are standard operating procedures that are set in place, right? That we're documenting the interactions or the lack of, being able to have a historic look back of, the attempts, the activity, what's been sent out. That's going to enable staff to have, encourage further compliance and have the data necessary in order to address any billing issues that might come later from that.
Okay.
Yeah, if I can just add, Eric, I just kind of off of Seth's and what Katie said too, but one of the things that we do too is we ask like our employees to be our best patients. So when we roll a new, self-service initiative tool out, we want our employees to use it, because then when our employees are using it, they can almost sell the tool to their patients. Because again, they're the ones working very closely in the office, that patient is, has that, connection with that nurse and things like that. And then, that nurse can say, oh, well, I use it all the time and I self-schedule my labs, or, I use it to register. So, anytime we, kind of roll something out, we're always asking our employees to be those, first pilot trials, give us feedback, tell us how it's working, and then go out and tell the patients about it too. So that's something that we do as well.
Very good. Okay. We're less than 20 minutes left of this hour. I just wanted to remind everyone that we will have some Q&A, some Q&A time. We will be taking some questions. We've been getting some pretty good questions in the queue so far. But I'm going to continue right now with this. here's an interesting one, and something we really haven't talked about too much yet, is how do these platforms, how do you work with payers, or do you get payers involved in this initial area to improve what's going to happen down the road a little bit? Are payers part of this process, Shannon?
So we've actually started having conversations and almost kind of providing performance metrics back to the payers. So within our centralized prior authorization space, we have a vendor for some automation within our diagnostic authorizations. And that vendor provides us a scorecard of, payer turnaround time, how do they compare with each other? And then I will report on those scorecards and send them off to our managed care teams to say, here's this payer here. We've got some really good automation and we're trying to get this patient in for their diagnostic testing. But wow, their, turnaround time is way, larger than some of these other payers. So we've been getting a little bit better with, providing the payers with how we feel they're performing. I also recently escalated some issues to our managed care team around some patient estimates with a payer. They weren't returning the standardized response in the 271, and it wasn't coming back in with our RTE vendor. And, it's kind of interesting to see then the downstream effect of how that translates into a patient estimate incorrectly. So now we're giving estimates to patients that say they owe $0 when that's not actually accurate. So we've actually been getting a lot better providing that information back to managed care when we're seeing these things, to have those conversations with the payers, because the information that we give to our patients is only as good as what the payer is providing us. So if they're not giving us good information, we have to give that back to them. So yes, we're doing a lot better trying to establish those metrics on payer performance.
Nice. Seth, same question. How do you fit payers into this process?
Yeah, I'd say it's a little more indirect, like Shannon. I mean, we'll provide feedback on things patients say, either yes, related to some of the cost stuff, or if there's, hey, the patient said they have this insurance, but your eligibility response came back with something else, kind of what's going on. I think it's really, we use this, if it's any real direct way, on some of the negotiating stuff. Say, look, we offer these great tools to your covered lives to, help make it easier for them to seek care from us, right? So we want to make sure we can attract, and they can, your patients can feel like they can get the care they need at the time they want, with open access to what they're going to owe, to Shan's point, things like that. So really, I think it's something like just maybe more of a selling point. And if we're trying to ask for something like, hey, don't forget, we did all these things to make it easier for your patients to get care. And again, I think they're appreciative of that, right? I mean, they get feedback from their patients that they feel like they can't find a doctor to treat them, or if they can't get in where they need in a timely manner when they're having an issue. But it's not as direct as I think some of the middle and back end things we work on. But I think this helps promote your hospital, give it a better view with some payers. Yeah, I mean, if you're someone who's like, hey, our doors are wide open and we have this turnaround time and we have these tools to make it easy, I think that does help somewhat. Again, I think anything you do to keep a good relationship with a payer is a wonderful thing in today's day and age. So I guess from that end point, I'd say it's a positive, but I don't think there's necessarily a true like one-to-one or hard ROI by bringing them in or showing them some of that data. But I think having good communication and highlighting the ways you're properly taking care of those patients is always a good thing.
Certainly, yeah. How about you, Katie? Can this be a tool to improve payer operations or payer relationships?
Yeah, well, I certainly think that, stronger collaboration of all key stakeholders that are, contribute to the, to patient care across the board is going to be, big time. The communication pieces, right? The transactions, if you will, like real-time eligibility checks, prior authorizations, even estimates, like Shannon said. That really all, I think, anchors or hinges on having secure, clean, quick, and easy data sharing, right? So being able to exchange data and reduce friction there is going to trickle down into the success of all those other areas and tools that we're reaching out to payers for. So
nice. Yeah. Okay, and that kind of leads to a question that we had in the Q&A. It's certainly a big issue, and this is a great segue for that. Do you see, can these tools, and we talk here about ROI, can these tools reduce friction in terms of reducing prior auths or improving the prior auth process? Can they reduce denials? Have you seen yet that doing this up front can lead to less troubles in the back end with the denials and the prior auths? Seth, what have you seen?
Yeah, 100%. I think so something I commented earlier, having the right insurance is a big deal for prior auths, for billing, for everything else. So yeah, I mean, we have seen that impact as we rolled out, that sort of kiosk or mobile check-in, kind of went area by area. And again, patients were providing much cleaner data, more accurate addresses and updated insurance information. Yeah, that has a huge impact. Like now we're not missing a prior auth because the wrong insurance was loaded and said you didn't need it for this procedure. Now we're not billing somebody and it coming back as denied because they're not covered by that payer or whatever. So absolutely, everything that happens up front, like we said, has major implications all the way through the rest of your revenue cycle, and through payment and closing out those accounts. So anything you can do to simplify that is a big deal. And I think the other one we see as a big ROI, and Shannon, I think, alluded to this a little bit, or not, Katie did, was collections. I mean, we have seen, as we've moved some of that up front and automated some of that with tools where they can, while I'm doing my check-in, I can also pay my copay, things like that. At that point, we've seen an increase in point of service collections because of that. Again, meeting patients where they are, giving them more options like mobile payment tools, Apple, Google, Zelle, whatever, to make those kind of payments, whether it's for their copay or their down payment for a procedure or whatever else might be. So we have seen increases in revenue tied to those things. So yeah, I think while there are a lot of soft benefits like happy patients and things like that, there's definitely some hard dollars also tied to it that kind of offshoot from this whole idea of good patient engagement.
Yeah. Okay, Shannon, same question.
Yeah, I would agree. So since we've put in the self-service tools, since we've created our centralized pre-registration team, our patient estimates, we have really great accuracy. So we've seen a decrease in eligibility denials, and we have seen an increase in pre-service collections as we've rolled out these tools to our front end.
And Katie, is this what you're seeing from across the board on this?
Yeah, I would say, we're definitely a metrics and data driven company. And so these are things that we look at holistically across, all of our partners so that we can trend and track what those metrics look like. So yes, I think that all of these contribute to the tools, the technology, the people, the ideas, the SOPs, all of the things combined definitely lead to driving metrics, like I said, in those desired directions. So we see across, holistically across reduced denial rates, even for, the authorization. So like, increase prior authorization, just the processing time alone, and then being able to automate those approvals. Those get approved at a high automation rate that allows staff to focus on those higher value tasks, those that need a little bit more attention or intervention because of the automation that's happening outside that.
Okay. Well, here's a good question, and this is kind of going to be the last question of this session. What I want to get into here is the idea of how this technology will evolve, how this service will evolve. Where do you see this going in the future? And along those lines, can you use this time at the front of the visit to to look at SDOH and to better understand why patients can't pay their bills to begin with. Shannon, why don't we start with you?
So yeah, I mean, I think we're doing a lot. We're looking at a lot of new tools, automated scoring models, trying to get those presumptive scores on patients and trying to understand what their financial capabilities are prior to their surgery, especially for our uninsured patients. So when we have, uninsured patients that are scheduled for service, we want those providers to kind of contact our financial clearance team and say, hey, I have this uninsured patient. We're starting to talk about a surgery and testing. Let's get them, kind of screen for financial assistance and Medicaid and things like that prior to service. So trying to, again, do a lot of that on the front end instead of chasing these patients after the fact.
Okay. Seth, same question.
Yeah, I think you can. Obviously, there's propensity to pay scoring. There's, yes, figure out people's backgrounds, if they're financial clearance, if they're eligible for Medicaid or some other program that can help cover them, and working on payment plans, understanding costs, things like that. Absolutely. We want to make sure everyone gets the care they need. We don't get sick, we don't really turn people away. But yeah, that's a huge part of this. Healthcare is not getting cheaper. And like I said earlier, people are right now very cost conscious given the state of things. And so we know this is something the government over multiple administrations now is really pushing, right? This transparency in what things cost, giving patients more ability to choose where they want to go, not because that's where my doctor is, but because this is where I can get the most cost effective treatment for what I need, whether it's meds, an x-ray, a visit, whatever the case might be. So yeah, I think understanding that, and I think it provides an interesting opportunity as well for healthcare organizations to somewhat brag. Look, I'll brag here. We're a nominal charge provider. We're very happy about that. So in a time when people are worried about costs, that's something we can really brag about, is we essentially have the lowest charges in the city. And, so if you are going to have to pay out of pocket, or if you have some, co-insurance amount or whatever, it's going to be less than at some other facilities in town. So absolutely, I think that's a big part of this. You don't want people to feel like they're getting crushed by debt. You don't want them to show up with some big bill for $80,000 afterwards that they didn't realize. And like I said, I think this is something you're seeing both from payers, from the government, from patient rights groups are really pushing on, more of that transparency, more giving patients that upfront ability and what options they have to still get the treatments that they need.
Are there any new services or new technologies that you want to see included in this process in the future?
It's hard to wave a magic wand, but sure. You can probably see some automation built around. So if someone does part of their screening is for SDOH, that there's some automatic things that fire off of that or whatever. But really, I think some of this, when we look at our determinants of health, a lot of it is the things around their care, like, they don't have a bed at home, or they're in a place that is asbestos, or whatever. It's not necessarily tied to can they pay their bill today, but it's can we help them do something that's going to keep them out of the ER and an inpatient bed 3 weeks from now. And so it's really, I think, when you start talking about this and what it means for your rev cycle and your collections and financial stability, sometimes it's more on the cost avoided side, I think we would say. And so technology that can help screen those patients and find those things and help pinpoint us to solutions to avoid what might be some uncompensated care later on is really where the win is.
Yeah, I'll just mention too that we've put our financial assistance application on our online portal. That way patients can go in and complete that and send in their information without sometimes having those uncomfortable conversations that they don't want to have. So we have felt that that's very successful. We've had more success with patients filling out those applications online than us, sending them a paper application or reaching out to them and things like that. Because I think it's just a little bit more comfortable and more private for them to have that access online.
I completely agree.
Yeah, we got a minute left. So, Katie, you're going to get the last word here. How will this evolve? What are we going to see?
I completely agree with both Seth and Shannon's feedback there. I think that making patients comfort comfortable is key, right? Personalizing their financial counseling in general, their options, their capabilities, and their actionable opportunities. So being able to use data integration and those predictive analytics and additional non-clinical factors to help, I would say, identify patients that might be at higher risk, and then being able to personalize, right, the next steps or the options that are for those patients are going to improve, how we treat patients.
Okay. Thank you very much. We've hit the top of the hour. We got another session coming right up in a few minutes. So that's all the time we have for questions today. In closing, please note that if you did register for the second panel of this summit titled Revolutionizing Revenue, Technology and Strategic Solutions for Prior Authorization. There we go. We're going to talk prior auths. A live clickable link will appear at the close of this session to take you directly over to that program. If you've not registered for that program yet and wish to attend, you'll need to click on the link and fill out the registration form to gain access. Kind of what we've been talking about for the last hour there. I want to thank our panelists, Seth, Shannon, and Katie, for a wonderful conversation. This is something we could certainly talk a lot longer about. And I want to thank our sponsor, Waystar, for making this session possible. Finally, thank you to those in our audience for attending, for participating. We hope you enjoyed this session and that you're going to join us in a few minutes on the next session, and that you're going to and for taking part in the summit, and that we hope to see you in future Health Leaders events as well. Thank you very much.
Great. Thank you.